I'm Dr. Adam Zolotor with the Department of Family Medicine at the University of North Carolina. I also have appointments at the Department of Pediatrics and the Injury Prevention Research Center. I've been involved in evaluating children that are victims of shaken baby syndrome or suspected victims of shaken baby syndrome for about 5 years. I work on the Beacon Child Protection Team and consult with cases of suspected shaken baby syndrome in the hospital. Shaken baby syndrome was first described about 40 years ago as a constellation of head injury associated with bleeding in the back of the eye known as retinal hemorrhages, and often associated with rib or long bone fractures. It's a constellation of symptoms that we see when infants or sometimes toddlers are shaken at high frequency, high velocity, and sustain a potentially devastating brain injury. The most important thing in reducing the risk of shaken baby syndrome is education, and we believe that parents need to know what the risks of shaking are. They also need to prepare themselves for the frustrations of caring for infants during the vulnerable period. We know that most babies suffer from shaken baby syndrome in the first 2 to 5 months of life, when infants tend to cry much more than younger and older infants, and this can be frustrating for new caregivers as well as caregivers that are tired from all of the usual challenges of infant caregiving. About 1/3 of infant victims of shaken baby syndrome will die as a consequence of their injuries. The remaining 2/3 can suffer severe lifelong behavioral, emotional, cognitive, and physical impairments. On average, survivors of shaken baby syndrome will be 20 to 30 IQ points below similar children that were not victims of this terrible injury. In addition, surviving victims may require lifelong assistance with breathing and eating. They may suffer from blindness, and they may never be able to walk again. We don't believe that most shaken baby syndrome is due to a caregiver intentionally trying to hurt a infant, but infants can be frustrating to care for when they've been crying for hours on end and parents are having trouble understanding what they need. Parents are growing tired, parents are growing weary, maybe they have to quiet their infant because they live in an apartment and the neighbors are getting tired of listening to the baby cry. And so we think that caregivers often lose control when they shake a baby without intention to hurt. We have some preliminary evidence to suggest that babies that are born premature, as well as twins and triplets, are at higher risk for shaken baby syndrome. We have also found that children of young parents are more likely to be victims of shaken baby syndrome, that is to say parents under about 24 years of age. We've had conflicting reports whether or not parents who are members of the military may be at a higher risk for perpetrating shaken baby syndrome. The take-home message when thinking about shaken baby syndrome should be that although this isn't a common problem, it's a severe problem that can kill as many as 15 or 20 babies in North Carolina each year and devastate the remaining 30 to 40 babies that are victims of severe shaken baby syndrome. And it's important to keep in mind that when you're feeling frustrated with your baby, you can find help. There are places to go. You should rely on your partner and your family members and friends, but there are other places to go. There's your local departments of social services and your pediatric or family practice provider that can help reassure you that your baby is growing fine, that there's nothing wrong with your baby, and that you're doing everything just fine as a caregiver.